All right, it is after 3:30, so we'll get started. Thank you everyone for joining us for our September Idea Lecture Series. My name is Celeste. I'm one of the OBGYN residents at UNC. I'm joined in this room by my co-residents and on Zoom by our speaker, Mr. Paul Cuadros, who will be talking to us today. I'm going to introduce him and then give him the floor for the full hour. Mr. Cuadros is an award-winning investigative reporter and author whose work has appeared in the New York Times, Time Magazine, the Chicago Reporter, among others. He is an author of A Home on the Field, How One Championship Team Inspires Hope for the Revival of Small-Town America, which tells the story of Siler City here in North Carolina as it coped and struggled with Latino immigration through the lives of a predominantly Latino high school soccer team. This book was selected as a common read at 4 universities, including here at Chapel Hill. In 2014, it was the television documentary series Los Jets was based on this book and premiered on cable television starring Mr. Cuadros. It was produced by J-Lo, which is almost as exciting as the context within the book itself. He is an associate professor in the Hussman School of Journalism and Media here at UNC Chapel Hill. He's a founder of UNC's Carolina Latinx Center, and he continues to write about immigration and the Latino community, and is currently working on another book that we'll soon get to read about the Latino community in the American South. The lecture today is themed Same Script, Different Cast. Mr. Cuadros is going to be talking a little bit about the Latinx community and their experience with and the burdens faced by that group due to the current COVID-19 pandemic. I have all of you muted, and I'll ask that you keep yourselves muted while Mr. Cuadros gives his presentation, but please do share questions in the chat box and we'll ask them at the end of the presentation. So the floor is yours.
Thank you, Celeste. I want to thank the UNC OBGYN and Ideals lecture team for inviting me to speak to you today about this, and the co-residents that are around. Hello. And when I was invited to speak about this, I thought this was extremely timely because this was all happening right at the time that I got this call, which was a couple of months ago. And COVID was hitting the Latino community, the Latinx community hard over the summertime, and still is. And we'll go through some of those numbers from the State Department of Health and Human Services. I started screen capturing some of those positive cases over the summertime just to kind of measure out where peaks were for the Latino community. I was doing that already before I got the invite. And then we can sort of review where we are today. But I do want to provide a primer on migration and how our state has changed with this current population that will hopefully explain or set up and provide background as to why the Latino community has been impacted disproportionately by the pandemic. And that's a fact. That there's no getting around that. We know that from the individual counts of workers and their families in towns that have large populations of Latino people or in our metro areas. And I've heard that anecdotally as well from UNC hospitals, from their ICU units, their pulmonary ICU units, in which they were receiving many patients from localities that had food processing plants up until recently. So all that we'll kind of touch on and discuss and provide good background information for why this community is being impacted hard by the coronavirus. So I'm going to share my screen, and we'll get started with some of these slides. And if I start to see that the time starts to get short on us, I will skip ahead with some of these slides so that we're not just in PowerPoint land going through a bunch of slides. So let me see if I can do this. Okay, I'm going to assume that you can see this page. Yes, some people are nodding their heads. Great. All right, so let's start with just kind of an overview about where Latino people are in North Carolina and their place in North Carolina. And there's no doubt that for this community, which is a growing community and a new community, essentially here in the American South, one that has been attracted by jobs in the agricultural sector and jobs in the construction industry and other service-oriented industry, and where their place sort of is generally within our society. And this is as essential workers. This was a concept that was already being applied to the community before the pandemic, given the nature of the work that they do in our state. And that includes farm work when it comes to agriculture, and it also includes food processing, in which North Carolina is one of the largest food processing states in the country, both for hog processing, chicken processing, and turkey processing, and even some beef processing, and also seafood. And then in the construction industry and the growth of the American South over the past 30 years, in how the South has grown and been invested in from businesses, from new migration from people from other parts of the United States, all sort of feeding into that industry of growth that's happened here in the South. If you've lived here a long time in the South, then you see many of our roads go from 2-lane roads to 4-lane highways. And that growth has been all created and constructed by these workers who have become essential. So let's take a look a little bit at migration just to give us kind of a background on this community and how and why it came here. And so for us, I think what we want to talk about a little bit is the factors of migration. And these kind of break down into two segments, one of which is push elements, or those elements that push people out of their home countries and into another country. And here for us, with the Latino population, it's livelihoods and the loss of livelihoods and job loss, mostly in Mexico, but also in Central America. And a lot of this is due to the free trade agreements that were passed in the early 90s, in which cheap American subsidized corn was dumped on the Mexican market and ended up essentially destroying subsistence Mexican farmers who were farming corn in Mexico. This is blamed for a large migration of people from the country to central cities in Mexico and then to the United States to make a living after our cheap corn is dumped on their market. You have to understand a little bit about Mexico and Central America and where corn fits into that equation culturally and economically. Corn is developed in this part of the world originally, and it is the staple ingredient for almost all foods in Mexico and in Central America. And this is why tortillas are so important to the Mexican people. And it's cultivated there, and it is a part of the culture there. And so when we ended up dumping a large amount of our subsidized corn from the US to Mexico through free trade agreements, we ended up destroying subsistence farmers that would cultivate corn in their small plots and sell them at market and survive. And once those markets were destroyed, many people came up here to find work in the 90s. Violence and the war on drugs is another factor for pushing people out of their home countries, and natural disasters like hurricanes in Central America also was a factor in terms of pushing people out of their countries, and war strife as well. And we can also see that from some Central Americans from the 1980s and the conflicts that happened then. And then family ties, of course, people begin to migrate where family members are. So for us here, we had a spate of people who migrated to North Carolina or the American South, and then other people who followed them who were family members from their home villages or towns. And there are places in North Carolina where you can see almost whole villages or departments within Mexico where everybody has moved here to North Carolina and the entire village is sort of here and the families are here as well. And then of course there are pull elements that attract people that add to the migration that's happened here in the South. And the biggest factor here are jobs. And again, I go back to the development of the American South in the 90s and early 2000s, the construction of new offices, schools, and homes that have happened in the South, and roads. And all that construction labor has been done for a large part by Latino immigrant workers. And then, of course, family ties as well. So jobs and family ties begin to sort of, that's the sort of attraction from here that lures people from their home countries in which people are being pushed out as well. And now, more recently, safety from violence. That's an allure for many people from Central America who are trying to escape gang violence and recruitment of gangs in their home countries and are fleeing and coming here to the United States. We see a lot of youth who come unaccompanied across our border for this very reason. I want to talk about the food processing industry as a gateway industry. It is an industry that has attracted people here to the South through its recruitment of workers from the border and in Mexico. And this is something that people kind of don't understand, or maybe they've heard about, but really the migration is actually triggered by our efforts here on this side of the border, looking for cheap labor to come into the interior of the United States by our food processing industry or our agricultural industry. And this is well documented in the advertisements that companies had along the border and in Mexico, asking people to come into the interior of the United States and not just the sort of ethnic enclaves of the Southwest, but to come into the interior of the United States in the American South and in the Midwest to work in the food processing industry. In many cases, these workers were transported from the border into the interior of the US to work these jobs. And this spurs migration in this area. In addition, many companies provided incentives for family members to bring other workers or their own family members to come and work in these plants. And so they'd give them a deal, they'd give them an extra $100, $200, some sort of work incentive for them to bring in more workers. And this is because the food processing industry is an industry that essentially just is constantly looking for new workers. It's a tough and dirty job, and a lot of people don't stay in it for very long. And turnover in some plants can be 100% in a year. And so it's constantly looking for new workers to come in and work in the slaughterhouses. And it will do anything it can to bring in new workers from wherever they are, and having whichever status that they may have in terms of immigration. And that's the second to last point here, is that the industry looked away when it came to employing workers legally who were in the country, authorized to work legally in the country. It sort of looked away from that and didn't really pay attention to that. That wasn't their purpose. Their purpose was to bring in workers and to have them work at their plants. And then finally, the food processing industry treats its workers as disposable workers, especially when they are immigrant workers who are out of status or have a complicated status with immigration. They become highly disposable in terms of if they're injured on the job, if they become sick on the job, if they start to cause trouble on the job, if they start to ask for increased wages or better conditions on the job. These workers are easily disposable and fired, and there's not a lot of recourse that many of them have. The migration leads to demographic change in North Carolina, and we're in that period right now. So we see a lot of small towns in the American South that have a food processing plant in which that town has changed dramatically over these 30 years in which we've seen this migration. And we've also seen our large metropolitan areas also transform as well. That's less from food processing, that's more from construction and landscaping and other service-oriented frontline work. But from what I've seen, from what my reporting has shown me, is that food processing sometimes is like the first footprint. So in 1997, 98, a worker from Mexico might move to a small town like Siler City, North Carolina, work in the chicken plant for a while, and then find a job on the construction site and work essentially all over the state in Durham, in Raleigh, or in Charlotte. This leads to large populations of Latino immigrants and their families in metro areas, and a large percentage of Latino families in smaller rural areas. So their numbers aren't as big in rural areas, but their impact is bigger because their percentages are much larger. And so the cultural sort of impact is felt more heavily in the smaller communities. And if you look at this particular slide, we can see where that growth has all gone. It's mostly gone into the American South in the last 10 years. And that's simply because of the efforts of the agricultural industry to recruit workers, and then for workers to sort of begin this migration that has gone on for 30 years now. And, quite frankly, has really slowed down since the Great Recession of 2008. That's when the migration has slowed down. And it's essentially been at zero at this point in terms of how many people come and how many people go back to Mexico. That's not necessarily true for Central Americans. That continues to happen. And again, that's happening because of trying to flee violence and trying to find safe havens. But overall, this region has been the region that has grown in terms of Latino immigrant population and its Latino population as a whole as well. And this little pie chart here, which was developed by the Governor's Office of Hispanic Latino Affairs, I was a member of that. I used 1990 to 2010 figures because nobody really knows what's going to happen in 2020 in terms of the census. So I'm going to hold off on going and using 2020 census figures once they come out because it's still being tabulated, sure, but the virus has impacted that, and other factors have also impacted that. But we can see how the Latino population here in North Carolina has grown from 1.2%, and in 2010 to 8.4. Today, it's estimated at about 10%, or 1 in 10 people in North Carolina are Latino or Latinx. At the same time, we can see that the white population in North Carolina has shrunk and continues to shrink. And this is a trend that's happening all over the United States. This is called the decline of that baby boom generation. And we're seeing shrinkage in the white community and plateauing in the African American community. And it's only in the Latino community and the Asian community that are the communities that are growing and also providing growth for the population generally in the US. And that's kind of what this slide shows. It's a remarkable slide because what it's showing is that the population change that's happened here in North Carolina and in other states in the South is significantly due to the Latino population that's come in and that's had babies here. So 25%, a quarter of the population change, the significant driver of our population growth in North Carolina is from this one community. That's really astounding when you think about it. It, of course, means all kinds of things, right? When your population is growing, your state is getting more representation in Congress. Your state is getting more funding from Congress for all kinds of different things. And so it's extremely important that this population is counted, but also that we're aware of like what's really driving the growth here in the American South. When you contrast our figures with figures in the Rust Belt Midwest, where population is in decline, they're getting less representatives. Maybe they're losing a member of Congress, so they're losing political clout, but they're also losing those federal dollars into programs like healthcare, access to healthcare, public health. All those things are impacted by these figures. And generally, just some more facts for the Latino population here in North Carolina. 1 in 10 now, maybe about 10%. But really the number here to look for is the median age of the population. And this is from 2010, so this age has gone up some. It did not include estimates from 2016 because, sometimes they're not as reliable as the hard numbers from the decade census. So in 2010, the Latino population's median age was 26, probably 27, 28 by now. And it's a relatively young population. I mean, this population is just a little bit older than my graduate students or medical students, for instance. It's a young population. And this is going to be significant in terms of what's happened with regard to the pandemic and the Latino population here in North Carolina. So keep this in mind when we go through some of these other figures. This is Chatham County. And in Chatham County, Latinos are about 14% of the population. It says 13% here, but today it's about 14% of the population. And this is a rural county that the chicken processing industry was the #1 industry for many, many decades. It had a decline during the Great Recession, but it's since rebounded over the past 3 years with a new chicken plant that has come to Siler City. And this is Siler City today. Here we can see that Latinos are close to the halfway point in terms of population within this town. Population size, maybe about 8,000 people, but half, if not more than half of the population, the majority of people in Siler City are Latino or Latinx. And this is not only true for Siler City, it's true for other little communities throughout North Carolina in which we've seen this demographic change and growth and migration. We're seeing majority Latino communities in Mayberry, essentially. And that's not only happening in North Carolina, but that's happening throughout the American South and also in the West. If we look at Siler City a little bit more closely, I just sort of am paying attention here to the median ages of people broken down by race and ethnicity. And here we can see that white folks in Siler City, their median age is 56, and Black folks, it's 43, but Latinos, it's 23, probably 26 by now. And that's so significant for this community. This is a young community. It's in their prime childbearing years, and they're having children now. And this is the reason why our population continues to grow while other cohorts within North Carolina are shrinking. This particular community is going to drive population growth for North Carolina. And it tells us why the health and safety of this particular community are so important to us as a whole for the rest of the state. You can't go to Siler City on a weekend and not encounter a christening, not encounter a baby shower, not encounter a wedding. It is a young community. It's a thriving community. And it's just, it's just kids. It's just always kids out there. You go to other communities that are small rural communities, and they are dying on the vine, almost literally, because their populations don't have an immigrant population in them, and they're aging out. They're getting older. Okay, and of course, people call that the grain of America, and that's happening generally throughout our communities in the United States, and that's the baby boom generation getting older, retiring, and going into their golden years. Siler City, on the other hand, is getting younger, and I think that's another thing that's fascinating about these particular communities is that the trend is not to get gray, the trend is actually to get younger, and that's fascinating. The healthcare needs of this community, the healthcare needs are all healthcare needs related to youth, to being relatively young. So the population is in their prime childbearing years, and the healthcare needs reflect that. Pregnancy and childbirthing needs are paramount in this community. UNC's Chatham Hospital, which is a brand new hospital, that's a regional hospital for UNC Health, just opened up a new maternity wing. They have not been doing this for a while, providing birth services in Siler City for, I want to say, at least 10 years. That has now changed. UNC Chatham Hospital knows that it has to provide this service. Most of the people in Siler City in the past 10 years have been having their babies in Chapel Hill. The new wing of UNC Chatham Hospital is going to be doing that in Siler City proper. And that also, reflects the youth of the community. Child health needs are important, of course. And here, with regard to the pandemic, vaccinations become extremely important for this community. They're already in the throes of vaccinating their children. For people that are trying or going to begin to sort of play out the vaccine that hopefully is coming in the next year or so. This is a community that is already in the sort of vaccine kind of world with their own children. And so that might end up influencing the rollout of that. It's something to keep in mind. And then, of course, occupational injuries are a big healthcare need for this community. It's a young community, it's involved in heavy labor. The food processing industry is one of the most dangerous industries in America. And so uh, it, it will have lots and lots of injuries, and those will be sent to hospital and so forth and so on. Same thing with the construction industry. And of course, other things that are impacting the Latino community now as they become more integrated in our society are issues of obesity, diabetes, and hypertension as their diets sort of change and become more like the American diet. All right, so let's take a look at the impact of COVID on the community, and then we can kind of open it up to questions and so forth. Yes, there's been a disproportionate impact of infection from the virus on the Latino community in North Carolina. There's been large and alarming percentages of infection in multiple counties throughout North Carolina, and community spread due to workplace contamination for the most part, but also in the home because of poor and substandard housing conditions. And Latinos have multi-generational families in these housing conditions. And so you see other members of the family that might be impacted by infection from COVID. And this is something that I think, the definition of homelessness is when you have multiple families living together and families don't have their own residence. For Latinos, this is sort of a natural thing in many cases, but it's recorded as being homeless. And so if we think about it in that way, we know that many members of our community don't have their own proper domicile. And that can impact spread of the virus to other family members. And then poor communication from public health officials in the early part of the pandemic to this particular community helps to spread the virus to the Latino community to have this disproportionate impact on the community. And finally, essential work conditions mandated by the federal government. So one of the very first industries that the president and his administration labeled an essential industry for essential workers was the food processing industry. And this was simply to keep the food supply lines open and clear for people that were sheltering to be able to go to the grocery stores and get food. This is also true for other frontline workers in grocery stores who are Latino, and in other industries, farm work, construction work. All those industries all became essential work mandated industries by the federal government. And then finally, work conditions and lack of benefits to stay home when people are sick to prevent contamination. All these things impact the Latino community and have done so the hardest to create this disproportionate impact. I did this screen capture back in July. This is July 26th, and this is from the Department of Health and Human Services from the North Carolina dashboard. I started capturing these screen grabs every now and then just to kind of have and file to refer back to. But here, back in July of 26, late July, the state was at about 112,000, 113,000 total positive cases. And then when we break that up by race and ethnicity, what we get is Latinos coming in at about 42% of these cases. Significant disproportionate impact within this community. African Americans at 24%, and then the white population at 56%. So we're talking about a population whose percentage within the state is maybe 10%, maybe about 1 million residents within North Carolina, but infection within this particular community has been disproportionate. I mean, there's no other way to look at this. And it's been across the board in terms of both metro area and rural area. Um, I think a lot of the media attention has been focused on the African American community, and I think rightfully so for some cases. But this is the other side of the story that has gotten and garnered less attention, the infectivity within the Latino community from COVID. If we want to take a look at Chatham County, then we're looking at a county that peaked at 59% in terms of infections for the Latinx community in Chatham County, and African Americans at 14%. Um, so this is a rural county, a poultry processing county, and many of the cases in Chatham initially began at one of the nursing homes in Pittsburgh, but at another one in Siler City, but also due to the chicken processing plant in Siler City that's owned and operated by Mount Air Farms. And that led to a spread within that plant that contaminated large numbers of workers. And we'll talk about that in a minute. This is Lee County's figure, another poultry processing town just south of Chatham County. And here we can see that Latinos, in terms of their infection cases, come in at 64% within this county. I mean, that's a staggering figure to think about in terms of people who are getting infected. You know, I have ties at UNC Health, at UNC hospitals, and at about this time was when we were hearing from friends at UNC Hospital who were working in pulmonary, and what we were hearing was just lots of patients being treated within the ICU from Lee County, and more than likely from one poultry processing plant there. This is Sampson County. This is near hog country and chicken processing country, south of where we are. And here we have a staggering 68% in terms of infections for cases of coronavirus for Latinos. But it's not all rural communities. So I threw this screen capture from July 26. Here we see Durham County at 65%. And this is not due to the food processing industry per se. This is all frontline workers in construction, in landscaping, in grocery store services, in restaurant services, in all different kinds of other landscaping, and all different kinds of other services in which Latinos are working and coming in contact with the virus and then spreading it at home when they go home. So this is not just an agricultural equation that certainly has gotten lots and lots of attention around the United States for the food processing industry, and that's definitely true, and nobody's taking anything away from that. But we can't take our eye off the fact that in our metro areas for Latinos, infected cases are also extremely high. And these are some of the industries in which we're talking about, in which Latinos are disproportionately being impacted from coronavirus. I see some people have some questions in the chat section. I think we wanted to save them for the end of the session. Is that right?
That's
Yes?
correct. We will we'll field all the questions at the end, but please continue to send them in.
Okay. And you know, these are all the areas of work that are essential work that Latinos find themselves working in. So, I mean, you could have predicted this once the pandemic started, and once people started sheltering, who was doing the sort of propping up of the society in terms of providing services and food and other services to keep people going. And it was all these sort of essential workers, frontline workers. And my take on it is that Latino workers never stopped working during the pandemic. They have never stopped working. There was never a time when they were sheltering in place, social distancing in a significant way. It was just impossible to do. So, and this is what we'll go into a little bit about why that might be on the job site. So poultry processing in Siler City, there's one large plant in Siler City. It's brand new. The company is based out of Delaware. They invested about $160 million in this plant. They employ about 1,200 workers. They have 2 shifts And they have all these sort of ancillary jobs as well. So they have a feed mill and they have a hatchery and they have a bunch of truck drivers and they have a lot of chicken catchers and a bunch of other people that work around the industry in Chatham County, adding into this one industry. All these ancillary jobs that are tied to that plant. So you literally have maybe a couple thousand workers that are working in the food processing industry in Siler City. One thing that I think people don't understand about the food processing industry or the chicken processing industry is that many of the workers are contract workers. They are not directly employed by this company. So when the pandemic hits, the workers who are getting sick are not workers from the plant. They are contract workers from another company that brings in those workers and that are trained by that facility. And because of that, they rarely have full health benefits or any benefits to stay home and still get paid while they're sick. They're not considered plant workers by the main company. And so there's less consideration of them when they become ill. And in some plants, the percentage of contract workers can be as high as 80%. And that's what we've heard at Mount Air when the pandemic originally breaks in Siler City at Mount Air, and they began reporting positive cases, which they eventually stopped doing. The company sort of began to say, well, wait a second, we don't have increasing numbers of our workers. But they were just talking about their workers. They had 80% of other workers who were working for other contractors for them, in which they were not reporting numbers allegedly. So that makes it really difficult to kind of know who within this factory is actually getting sick. And workers work side by side in a food processing facility. If you've ever seen a chicken plant, it is essentially a disassembly line in which workers stand side by side with knives and a conveyor belt goes by and they are literally just cutting up and making specific cuts on a chicken and then tossing them on another belt to be further processed. But everybody's standing side by side down a conveyor belt. And so people are in close proximity with each other. And at the beginning of the pandemic, nobody had any PPE. There was no social distancing. So, I mean, these were factories in which you couldn't help but spread COVID, given just the working conditions that they were under at the time. Mount Air in Siler City is a brand new plant. I mean, that's as state of the art as you can get in terms of the food processing industry in these plants. But the model is for people to stand side by side as they disassemble a chicken. It's been, if you know, and if you've done any reporting on the food processing industry, then you know that their workers are disposable. Oftentimes they're immigrant workers. Oftentimes they don't have an immigration status to be authorized to be in the country or to work. And so they're not treated as a US citizen worker might be treated. And so they're highly disposable. And that makes them highly malleable for the company to get them to work and to keep them working. And for the workers to be afraid to complain, to speak out for themselves because they might lose their job. The same is true in the construction industry, where you have work crews that consist of contract workers on a job site, and they're from all over, right? So if you know anything about the construction site, you know that there are a variety of different contractors and contract workers at a construction site. And so there isn't just like one company that's sort of minding the workers. And so here in the construction industry, workers are disposable and will often work when they're ill. If you get sick in any of these sort of jobs, nobody's paying you to stay home and be sick. In the early part of the pandemic, no PPE was provided on the work site. And in addition, even though in the construction industry you're working outdoors, people are riding and sharing rides together to get to the construction site. And that's the thinking from talking to workers. That's where they think that they may have picked up the virus and taken it home. And of course, workers feel compelled to work to stay on the job. Housing conditions, housing conditions in many of the rural areas in which you have the food processing industry are substandard. When Mount Air opened up in Siler City, it created a problem because there wasn't enough affordable housing for workers. And so many workers live in multi generational housing that's poor, and where simply trying to social distance is impossible. And Latinos also lack access to banking facilities that don't permit them to buy their own homes. And we may have multiple families living together, um, in which case we can consider them to be homeless. Uh, Many Latino people report being afraid of becoming sick from the pandemic. Many workers are afraid to bring this virus home, but feel that there's no choice. So they feel like they're caught between having to work and have an income or just getting sick and riding it out. And depression is a major issue within this community since the pandemic. I mean, it is generally for all of us. I think everybody sort of feels this anxiety, but certainly in the Latino community, there's no choice here in terms of what you have to do. Access to care, of course, is lacking within the Latino community generally. And this is an old statistic, but I think we generally know that access to health insurance is not high among Latinos who are immigrant Latinos or Latinos who are even born here in the US. And this, of course, relates to the types of jobs that Latinos are doing in the United States. I'm running out of time here, so I'm trying to get through a little bit of this. I think many Latinos, when talking to them, are resigned to the idea that they will get this virus from their work conditions. And so this has an impact on social distancing for many people. I've talked to workers who have said, well, I'm going to get the virus anyway, so why do I need to social distance? And I'm going to go home and we can't social distance there. So yeah, I'm going to go out and play soccer with my friends because I'm already exposed at work. So what's the difference if we go to a cookout or a soccer game or whatever? We're just going to do this. And so there's a very different attitude about the virus because of this. Um, of course, later on, there was an incident in which Senator Tom Tillis brought this up in an interview in which he blamed this community for spreading the virus and not understanding the fact that when you are an essential worker, that you don't have a choice in terms of if you become infected, if your work site is not practicing good practices, and if your home site doesn't allow you to social distance. And so there's been stigma within the community because of that. I just want to go into depth very briefly. So while we've seen a high number of positive cases among Latinos in North Carolina, this slide is from this screen grab is from July 26 too. We don't see as high a deaths within this community. So Latinos, 11% at the same time died. Where if we compare that to the African American community, they have a much higher percentage when it comes to deaths. And that's significant to understand about how the virus is impacting this community. So while infection is disproportionate, deaths were not seen as an equally high number of deaths within this community. We can look at the same thing in Chatham County. If we recall, I think Chatham was at 58% in terms of positive cases at the same time, but deaths were only 6%. In Durham County, we were in the 60s for positive cases for Latinos in Durham County, but Latinos were only 14% when it comes to deaths. So, and this is sort of my own sort of thinking and reporting is that while Latinos are suffering disproportionately from infection from coronavirus, uh, deaths have remained fairly low. And I think and we can discuss this, I think we need to go back to that median age to understand that this is a relatively young community. And so they may be doing better with this virus because they don't have those baby boomers, lots of baby boomers within their community that are elderly or becoming elderly. And so I think this leads to a bunch of questions for us. Will Latinos recover and develop some sort of immunity given the amount of spread that's happened and given that the impact in terms of death hasn't been as disproportionately high? And of course, will this immunity last, or will this community continue to be sickened based on their working conditions and so forth? Or will Latinos emerge stronger from this pandemic or weaker? I mean, I think these are all really interesting questions. And of course, research is probably needed for this cohort to understand how the pandemic went through an essential community, essential working community, and the impact that it had. And then, of course, what will the lasting impact be on the Latino community? It is a driver of growth for the United States and for North Carolina in particular. What does that mean for our future? Today, these are screen grabs I did yesterday. And here, the total positive cases for Latinos has dropped to 37%, but deaths has remained at 11%. So I think that's rather interesting. I mean, all the numbers have sort of dropped, of course, but not as high as it was. I'll leave you with this last slide before we have a discussion, which is essential does not mean expendable. And I think this is something that we need to think about, that essential workers and families are not expendable. And I think that there's been this sort of developing idea that, they're essential, so they get to go out and they get to be at most risk. Okay.
That was
I'm,
great.
I'm
Thank you
done with
so
those
much.
slides.
No, that was perfect timing. We have almost 10 minutes, or a little over 10 minutes, excuse me, for questions. I will start with some that have come in from the residents here on campus. Part of the questions address what you were talking about as far as assistance for whether it's hazard pay, coverage, or what things are being done to go out into these communities through public health efforts to kind of address the community health needs, and how our patients or residents able to afford these kinds of services, if at all.
So, Health and Human Services is fully aware of the impact on this community, and it is throwing resources at it. I think initially that wasn't necessarily the case. Certainly, they had their hands full. But as everybody began to realize the impact on this particular community, there's no doubt that Health and Human Services has tried to step up to address these numbers and to get the word out in these communities about how to protect themselves. At the same time, Latino media in North Carolina has also stepped up. For the most part, Latino media is relegated to community media, small newspapers, um, radio stations, social media, and community groups are all trying to get this message out to the community about social distancing and PPE. But that's been difficult just because of the work site and because of transportation needs. So that remains something that is still a challenge. We are seeing numbers drop from a peak of 43% to what now 37. So I think that's significant to understand that there is a downward curve on this. Um, there's no doubt that at companies like Mount Air, for instance, they have implemented more spacing on the line, including plexiglass in between workers to help them provide some protection within the plant. These plants were not designed for a pandemic in mind, and so they've had to modify them as much as possible. Modifying the sort of labor structure is a different deal. And this is something to consider going into the future, of course, is how do we make work that has always been dangerous and work that's always been, where the workers have always been sort of devalued in many ways, how do we make it so that they are valued and that we sort of not just label them as essential in terms of their labor, but also in terms of safety and in terms of compensation.
In your opinion, if there was an adequate public health response to the pandemic, um, would you assume that there are no structural or legal conditions that would have allowed this community to thrive, or do you think that they would have suffered these disparities regardless of the public health response initially at the beginning of the pandemic?
Just given the way work is, in which workers are sharing rides together on the same trucks for construction work, where you have a work crew that is essentially one crew and everybody kind of knows each other. People share rides to go to the work site. I mean, that's an enclosed environment. So if one worker is sick and asymptomatic, everybody's in close proximity. Within a plant itself, again, you're in proximity to people. There's just kind of no getting around that, at least at the beginning of the pandemic, right? I'm not sure if there's anything that public health could have done with regard to workers that were essential and frontline workers.
Another question comes up just about the impression of the healthcare system or of healthcare providers in the Latinx community. Is there, in the communities who you've interviewed and spent time with, is there a general mistrust or lack of trust among Latinx communities in North Carolina or in Chatham County specifically, or in Siler City? Thinking about the way that the African American community is often perceives healthcare and research and clinical medicine. Is that a similar feeling?
No, that's something that I've not encountered. Um, Maybe the beginnings of, Latinos use and consume a lot of social media, and that seems to be where they get a lot of news. And so when social media is fed with conspiracy and a bunch of other misinformation, that can have an impact. It's not historical in the way that it is with the African American community. And so it might be based on social media. That's my thinking. But Latinos, um, because they're young and they're having kids now or have kids now, they've been through the whole sort of cycle of getting vaccinated for their children to be able to go to school. And so that's a compliance within the community, um, where you don't see, this sort of anti-vaxxer movement or distrust in medicine or in healthcare. Instead, it's all a question of access to care and not having health insurance to be able to access care and delaying care until it's very late in the stages, and of course you have to use the emergency room to get care. So all that is more of a factor, I would say.
Are there laws that you know of in North Carolina that address the need for a provision of medical interpreters for non-English speaking or for whom English is not their primary language, for patients with non-English proficiency? And is that something that you think would help improve communication to these communities?
Having a legal mandate, I haven't heard of a legal mandate of a law that requires a hospital or a healthcare facility to have an interpreter available. Um, my experience has been that this is something that hospitals and clinics have done on their own to address the needs of a growing community. So, and I've certainly been involved in efforts at UNC Health and UNC hospitals to originally start that like 15 years ago, 19 years ago. But I don't know of any legal mandate that requires a hospital to provide a translator. But I'm not sure about that.
Okay. Another question. Have you encountered a significant delay in the Latinx population's ability to get to care with regard to the COVID crisis? And is this leading to worse outcomes in the community?
So, I think this is on target in terms of access to care because of lack of health insurance. So, if you're a Latino immigrant, odds are you don't have access to health insurance. So, that one stat I put up from the Pew Research Center back in 2007, their national survey showed that 80% of Latino immigrants did not have health insurance, access to health insurance. And so that of course forces you to delay care when you need it. And of course, people are scared, right? I mean, people get scared if they think they're sick or they have COVID. So that's a real factor in terms of getting care right away. In terms of bad outcomes, that's an interesting question. I don't think there's data on that. There's only anecdotal stories right now, but that's something that I think needs to be researched um, so that we understand if the lack of insurance has delayed care and then has led to a poor outcome. That's why I think that looking at the positivity cases and their disproportionate sort of numbers, and then looking at deaths and understanding that they've been in the 10% range, 11% range, and nowhere near the 68% range, leads me to think that their outcomes have been fairly well. And I think that's attributable to the relative youth of the community, but that is unproven and that needs research.
Mhm. And then for our last question, what would you think is the biggest takeaway for clinicians or for future physicians? We have a lot of medical students on the call about the ways in which we should interact with these communities that who we encounter in the hospital. Is it more important for us to take a route about education? Should we be going out into these communities to play a role as almost as public health care workers and making ourselves available, or is there something that we need to do about the way that we interact with them here in the hospital setting?
At UNC hospitals, this has been a changeover over the past 15, 20 years in providing services for this community. I'm going to assume that it's fairly decent. I haven't checked in with it in a while. Certainly, it would be better to have physicians, nurses, and other practitioners who are Latino or Latinx and can have that affinity. That I think is always something that can put people who are feeling sick at ease. Within a rural community, I think the regional hospitals are a real important factor in this. So UNC, Duke, other companies are investing in regional hospitals to some degree. And of course, we know that some of our regional hospitals are not doing well, and that the virus might end up finishing them off, and that's going to have a real impact on this particular community, where so many people are working in agriculture and rely on a regional hospital for point of access or initial access to care, and then not having to go to a metro area for hospital care if their condition gets worse. So I think that's a really important issue, is how our regional hospitals are going to do during the pandemic and post-pandemic if they survive. So that's a looming question. I'm reminded of the National Health Service, uh, where medical students, I don't know where this program is today, but once upon a time, that service would provide debt relief if medical students would agree to practice in an underserved area. Those are programs that we should be investing in today. And I hope it's still up and running. I haven't checked in on it in a long time, but that would be something that people can consider if they're looking to pay off debt and also serve in an underserved area for a period of time.
Well, Mr. Cuadros, we cannot thank you enough for giving us your time today and sharing your expertise. We definitely would ask our participants to go to this link and complete our post-lecture survey. And on behalf of all the participants today who have joined us, thank you so much for your time. This lecture will be posted for those who weren't able to join online, and we'll see you next month. Thank you so much.
Thank you, Celeste, and thanks to Matthew as well.